my dear nurses, my name is Vijita, nurse instructor at DHA Coaching Center. In this video, I am going to discuss very important questions frequently asked for Prometric exam. Those who are preparing for Prometric exam, you can watch this video till the end, and I would request all of you to write down important points what I am going to discuss. Okay, that always help you to pass your exam. So here is the first question. So first question is, in evaluating the appropriateness of various exercise enjoyed by a patient with osteoporosis, the nurse should recommend. So what is the meaning of this question? It is, what kind of exercise usually we recommend for a patient with osteoporosis? So let us talk more about osteoporosis. What is osteoporosis? It is demineralization of bone. Usually bones are mineralized with, or bonds are usually strong enough because of the presence of calcium and phosphorus which is mineralizing the bone which is within the bone. Okay, so when we split osteoporosis as two, osteo and porosis. What is osteo? Which is related with the bone. Porosis, that is number of pores which means holes. Okay, so in osteoporosis what happens? Inside the bone there are number of holes which is formed. Why? Because of deficiency of calcium, or it can be deficiency of vitamin D, or some person who are not eating proper amount of calcium, or there are multiple reasons for osteoporosis. Fine. So in osteoporosis what happens? The entire bone will become very weak and fragile, and it may break very fast. So what can be the complications which is expected as a result of osteoporosis? It is fracture. Okay, so basically in osteoporosis, bone is not strong enough to compensate the entire functions of our body. So usually muscles get more tired because the entire strong or strength and the weight is transferred to the muscles. So usually there may be higher chance to get muscle weakness and muscle spasm or inflammation of the muscles as a result of this. Okay, we'll see what are the signs and symptoms of osteoporosis. Basically, because of osteoporosis, what happens? It can affect the vertebral bones. So see, look at this picture, and the patient will have pain on the back. So because of pain on the back, their posture will be slightly turned or changed, as well as there may be back vertebral bone compression may also happen. So automatically the height will reduce and the posture of the patient may always turns, and it can cause kyphosis. What is kyphosis? Forward curvature of the thoracic spine is considered as kyphosis. So I repeat, what is osteoporosis? It is demineralization of bone, or multiple pores are formed within the bone and bone is not strong enough, or bone is fragile and there will be higher chance to get fracture. Fine. As a result of osteoporosis, muscles get more inflamed and there will be chances to get a muscle weakness. So, in order to strengthen the muscle weakness, or in order to strengthen the muscles, in order to reduce the weakness, you have to encourage the person to do exercise. So, the question is simply meant that what kind of exercise usually we recommend the person to do. So, options are walking and bowling, sit-ups and golf. So, which of the following exercise strengthen our muscles? So, what can be the answer? Yes, please. You can just think and you can select the answer. And along with this, what you need to do is, you have to note down what is osteoporosis and what all are the reasons for osteoporosis. Okay, already I said like deficiency of calcium, deficiency of vitamin D, and those who are not eating adequate amount of calcium, and there are a number of other reasons. If you want, you can just note it down, the other reasons. Certain medications causes osteoporosis. Number 1 is synthetic thyroid medications, and number 2 is corticosteroids. Number 3 is oral contraceptive pills. So a person who has been continuously taking corticosteroid may develop osteoporosis because steroids reduces the absorption of calcium, and even the same way oral contraceptive pills, estrogen imbalance can also causes deficiency of absorption of calcium. Clear? And there are many more anti-epileptic medications, and like antacids, certain antacids will also causes osteoporosis. Clear? And the other conditions which contribute to osteoporosis is renal failure. What happens in renal failure? In case of chronic renal disease, vitamin D activation is not happening properly. So as a result of that, calcium absorption reduces. What is the relation between vitamin D and calcium? Usually vitamin D is helping to synthesize calcium, or calcium metabolism is stimulated by vitamin D. Okay, and vitamin D is usually activated by kidney. So kidney disorders definitely causes osteoporosis. Okay, and deficiency of calcium already we said. Postmenopausal women are having higher risk for developing osteoporosis. And smoking, those who has been like continuously using smokes or smoking history definitely reduces the calcium absorption. Okay, so there are number of reasons for developing osteoporosis. So please remember what are the reasons for osteoporosis. Fine. And what are the signs of osteoporosis? There will be muscle pain, there will be kyphosis, and there will be inability to perform any kind of activities. So here what is our goal? You have to avoid getting complications like fracture, and you need to strengthen the muscles by performing certain kind of exercise, and the better exercise from these four is walking. So what is the answer for this is walking. Clear? So this is all about these questions, and we will discuss another question. And you can just go through this. This is whatever I have explained. Everything is here in this slide. So if you want, you can just note it down. And next we'll move to another question. Here is the second question. A hospitalized patient has fallen from bed, and the nurse note shortening of the left leg. Pain upon movement of the leg, and a rapid and shallow respiration. There is a typing error, I'm sorry. It's a shallow respiration. And what action should the nurse take first? So what is the situation here? A hospitalized patient had a fall from the bed, and there is a shortening of the left leg. Okay, and there is a pain upon movement of left leg, and there is rapid and shallow respiration. What is this indicating? So here, shortening of the affected extremities. Shortening of affected extremities, that is indicating sign of a fracture. So remember, shortening of affected extremities are indicating signs of fracture. And definitely along with the fracture, there will be pain, and the pain automatically changes the respiratory pattern. So this is ultimately indicating fractures. Okay, so the question is, what nursing action is the first? So what is the key here? Key here is first nursing action. So you have to focus first nursing action. So in case of fracture, how do we manage? Always remember, while managing fracture patient, you have to follow the emergency thing as eyes. So in management, you can just remember eyes. Okay. So what is I stands for? I stands for immobilization. C stands for cold application. E stands for elevation. I repeat. I stands for immobilization. C stands for cold application. And E stands for elevation. So what is the management? Acronym, it is eyes. When you get any of patient with fracture, you can follow this particular method. First, you need to immobilize the patient. Then you can apply cold application. Then you can elevate. Now, when you learn something, even it can be a sign or it can be an intervention, what you need to do is, you have to ask why. Why immobilization? Why applying cold application? Why elevation? Okay, so you have to get the answer for why. So why immobilization? Immobilization is usually necessary to prevent further fracture or complication of fracture and fat embolism. Clear? Why wall application? To reduce swelling. Usually in fracture, what happens? There may be chances to get swelling. Swelling, it's because of cellular inflammation. So swelling is associated with a fracture. So swelling definitely increases the intercompartment pressure and it could end up with a compartment syndrome. So why wall application is necessary? To reduce swelling. As a result of that, you can prevent compartment syndrome. Why elevation? Elevation always enhances the venous return and that is also helping to reduce swelling. Okay, so how do we manage a patient with a fracture? You can follow this acronym: I for immobilization, C for cold application, and E for elevation. Yeah, so from this, what is the immediate nursing action? Now I think everyone got the answer. It is immobilizing the left leg. So what is the answer for this? Is second one. Clear? Now just look at this fracture types. There are a number of fractures. There is an open fracture. There is closed fracture. There are a number of different fractures. So look at this. You can just go through this. The first is transverse fracture. Second is a linear fracture. Third is an oblique fracture. And this is one is oblique with non-displaced, where this fracture is oblique. The shape of the fracture is oblique, but it is not displaced. Where the fourth one is oblique fracture, where these bones are separated. It is considered as oblique displaced. Clear? And this is spiral fracture, where the shape of this fracture is spiral in shape. And next is green stick fracture. Green stick fracture, which means the one part of the bone is usually fractured and the other part is, look at this, other part is completely alright. Okay. So green stick fracture is commonly expected in children. Okay, so that particular point is really important. And the last one is caminated fracture. It is the bone is fractured into multiple small fragments, or it is a kind of crushing type of a fracture. Okay, there are many more type of fractures. So at least these types of fracture you just remember. There is transverse fracture, linear fracture, oblique, displaced and non-displaced, spiral, green stick, and caminated fracture. And there is another common type is open fracture and closed fracture. So open fracture, it is the bone is fractured and the skin is not intact, where the skin is also broken and the fractured bone fragment is exposed out, is considered as an open fracture. But what happens in closed fracture? The bone is fractured, but even the skin is also intact. So the fractured bone fragment is not exposed out. So what is the difference between open and closed? In case of open fracture, the bone is visible outside and there is an open wound. So it may get contaminated. Fine. But in closed fracture, there is no open wound, but still bone is fractured, which is there inside itself. There may be higher chance to get bleeding inside. Even in open fracture also there is chances to get bleeding, but it is visible outside. But in closed fracture, the amount of bleeding which is not visible outside, but there will be lesser chance to get infection. Infection of bone is considered as osteomyelitis. So osteomyelitis is usually expected in open fracture, whereas that is not expected in closed fracture. So you can just remember what is open fracture and what is closed fracture. Osteomyelitis is expected in open fracture rather than closed fracture. But in closed fracture, there may be higher chance to get bleeding. As a result of bleeding, there may be higher chance to get hypovolemic shock. So this is all about this. I repeat this. What all thing you have to remember regarding fracture? What is fracture? What are the types of fracture? And how do we manage a patient with a fracture? Okay, so this is really important. And see, when you are not following the proper management in an order, you are making the patient in a risk. Okay, so while managing the patient, please remember that don't make the patient or don't put the patient into risk. Okay, fine. So we'll discuss another question. Here is the next question. A client with a road traffic accident, and the patient appears restless, confused and disoriented. He reports that he had hit his head against the steering wheel of the car when it had collided with the car directly in front of him. So the key of the question is, what is the most important next step in management? So here a patient is presented in the hospital with road traffic accident, whereas on examination patient is restless, confused and disoriented. And when you approach the patient itself says or patient admits that he had hit his head against the steering wheel of the car and when the car collided with the car which is in front of him. So it can be like this, while driving, when the car hit on another car in front of him, so the patient will get an injury. Most probably what happens, while driving we use seat belt. So with the speed the car coming, the same speed our body is also coming front, and suddenly when the car gets hit with a car in front of him or in front of the car, what happens? Our body will be stabilized with the car seat belt, but the head is not stabilized. So when suddenly the car stops its driving or stop its running, our body's position will also change and our body will be stabilized within the seat itself with the help of seat belt, but the head is also moving front and the head had hit on the steering wheel. And it will not happen in a single time. It will hit again, the head will move back and then the same force, how the head will come front. This happens multiple times till the car stops its function. Okay, and probably these kind of injuries causes neck injury or cervical vertebral injury. Later on, cervical vertebral injury can cause cervical spinal cord damage and it causes central cord syndrome. Okay, so here on examinations, patient's vital parameters are given. Out of this, BP is slightly low and heart rate is okay and respiratory rate is high, temperature is almost okay and saturation is within normal limit. And what is the question here is, what is the most important next step in management? Usually these kind of injuries will be managed by emergency management. And while handling this patient, you have to be very cautious that the head and neck of the patient should be immobilized. Why? Because while handling this person, you should not allow the patient's head and neck to mobilize vigorously, because that will cause further cervical vertebral damage and it can cause spinal cord damage. So you should not put the patient again into harm. This is the point where always you need to remember. While handling the patient or while changing the position of the patient, while securing the patient from the car seat to the stretcher, or while taking the patient into hospital, while changing the position, while shifting the patient from stretcher to the hospital bed, always remember that you have to immobilize the head and neck of the patient. Why immobilizing head and neck is really important? To prevent further injury. Okay. Remember, only mishandling by a person, those who are handling this patient, can cause lifetime complication like a central cord syndrome or the cervical spinal cord injury. So you should not put the patient into major complicated situation or don't put the patient into a risk. Okay, so remember, while managing this, head and neck immobilization is really important. So look at the option. First option is immobilizing the head and neck. Option 2 is oxygen administration. Third is putting a IV line or establishing an intravenous line. And third one is arranging for an MRI. Okay, so here oxygen is not really necessary because saturation is within normal limit. So at present oxygen is not necessary. Intravenous line is also not necessary because usually patient doesn't require any of fluid because BP is always in the normal. And MRI scanning will always help to rule out or identify any bleeding which is present in the head. Definitely we have to do that. And the initial first step, next step of management, the key of this question, look at it here, it is important. Next step is immobilizing the head and neck? So these kind of questions are really important, and this is really common question. So you will get all these kind of questions frequently. So please write down while managing a patient who suspect with any kind of spinal cord injury. That can be a driver who is driving and having a injury like this, like the car is hitting in front of the car. Okay, so these kind of injuries, or any kind of fall from height. Okay, so these are the certain injury where we suspect head injuries or neck injuries. So while handling the patient, you should be always cautious that head and neck should be immobilized. So even keeping the patient still in the patient's car seat itself, you have to provide the care, and while shifting the patient, always remember that head and neck should be immobilized. So what is the answer for this? Is the first answer. Okay, so any doubt? If you have any doubt, you can put your queries and doubts in the comment box. Thank you for watching. God bless you all.